Totally. It links very well with the title of this webinar, interoperability, and how do we talk to each other in terms of data as well. So any advice, you ask me for advices on this respect. There is certainly a safety issue for this data. Where do they go, right? What happens to them? And this is linked very well to the interoperability of those data. If we create a European health data space, who makes sure that these data are protected and very well used? There's an ethical question there as well. So we need to rely on the institutions. We need to rely on the fact that currently there are strict rules about the management of data, such as the GDPR, and certainly a lot of regulation that provide that safety for the data. So on this respect, there is already a direction there, and in the EU Act, there's a lot of material into that as well. Secondly, about the use of the data by the providers, by the institutions, there is a particular attention from each of the institutions, particularly public and private. There is a delegation of such roles. So I find that, yeah, maybe if you are a clinician, sort of saying there is a responsibility into treating ethically the data, but maybe there is a delegation that can do that. So that's also very, very possible, a possibility there. And then finally, the use of the ethical data, it is a responsibility of each actor and stakeholder in the ecosystem to provide that certainty, that safety for the data. Now, there was a project, the electronic health record for the patients, and talking about interoperability, that has a lot of potential. And it is certainly a platform talking about the European health data space, but not only, also about other initiatives. There's a possibility into there, but there's also a risk when using those data, developing algorithms, starting from those data. And I want to highlight as well that since before it was not properly done, it was not previously done, that this represents a huge opportunity for discovering ways of treatments that before were not contemplated, thanks now to the AI. Having a lot of data, there's someone recently that mentioned that the AI, the artificial intelligence, is going to transform into agents manipulating those databases. You have a big, huge database, and so the artificial intelligence will not contain itself the database. It's just a translator, a manipulator, a manager of such data. And as I was saying, having a huge database of all the clinical data of the biggest, potentially the biggest database in the world about healthcare, then may provide a very huge opportunity for our humanity to still evolve, exist, and to be treated.